Hello everyone. Today we are going to see about case study on occlusion of the proximal left MCA. Before moving into the case study, we will see about occlusion of the proximal left MCA or middle cerebral artery means a blockage in the beginning part of the artery on the left side of the brain. In the left side there is an artery called the middle cerebral artery. Occlusion means blockage. Occlusion of the proximal left MCA means blockage in the beginning part of the artery in the left side of the brain. This can lead to a stroke affecting the right side of the body, potentially causing severe neurological deficits like hemiplegia, means paralysis, hemianesthesia, loss of sensation, and loss of vision. MCA means middle cerebral artery. It is a major artery that supplies blood to the brain, specifically the frontal, parietal, and temporal lobes. Proximal refers to the part of the MCA closest to its region from the internal carotid artery. Occlusion means blockage. The impact of the proximal left MCA occlusion can cause stroke because it deprives the brain tissue supplied by the MCA of oxygen and nutrients, leading to a damage and neurological deficits. Today we are going to see about a case study on patient name is Kumar, a 55 years old male, came with a history of hypertension, type 2 diabetes, smoking 20 pack years, hyperlipidemia, previous transient ischemic attack 2 years ago. Social history: patient is a retired accountant, lives with spouse, moderate alcohol consumption, 2 drinks per week, sedentary lifestyle. Kumar was brought to the emergency department, that is ED, by his wife after suddenly developing a slurred speech, right-sided weakness, and facial drooping at approximately 10 am. Symptoms begin while he was eating breakfast. His wife noted he was confused and unable to lift his right arm. Emergency medical services were called, arriving within 15 minutes. By initially doing the physical examination of the patient, first we have to see the vital signs. For this patient, the blood pressure is 180 by 90 mmHg, heart rate is 88 beats per minute regular, respiratory rate is 16 breaths per minute, oxygen saturation is 96% in room air, temperature is normal. In this vital signs, the BP significantly abnormal for this patient. The another vital signs are normal. In neurological, because he was a known case of hypertension. Next we are moving into neurological assessment. In neurological assessment, Glasgow Coma scale was 14 by 15, that is normal. The right-sided hemiparesis and right facial drooping, dysarthria, and partial neglect of the left visual field is present in this patient. Next we are moving into initial management. The patient was arrived at 10 am and furtherly doing the imaging test, the non-contrast CT head, no evidence of hemorrhage, early ischemic changes in left middle cerebral artery. By doing the CT angiography, we have find occlusion in the proximal left MCA. CT angiography means computed tomography assisted angiography. Angiography means visualizing the blood vessel. By doing the CT angiography, we have find occlusion in the proximal left MCA. For furtherly, we are going to the treatment. For this patient, we are doing intravenous thrombolysis with altipase, initiated at 11 am within 4.5 hour window. Dose is 0.9 mg per kg. Blood pressure managed with IV labetalol to maintain 180 bar 105 mmHg. The patient furtherly transferred into the neuro-intensive care unit for further monitoring. At 3-month follow-up, modified Rankin scale to Kumar quit smoking, adopted a low sodium diet and began a supervised exercise program, continued to clopidogrel, atorvastatin and antihypertensive medications, mild residual right hand weakness and occasional word finding difficulty persisted. For this case discussion, the case illustrates a typical acute ischemic stroke presentation and management within the critical time window. Key points to include rapid recognition. The fast. Fast means face, arm, speech, time, criteria facilitated early identification by Kumar's wife, enabling timely EMS activation. This is one of the most important thing in this particular case. Next is thrombolytic therapy. Administration of TPA within 4.5 hours significantly improves outcome, consistent with guidelines from the American Heart Association and American Stroke Association. Risk for factor management. Kumar's hypertension, diabetes, and smoking history were major contributors. Post stroke care focused on lifestyle modification and secondary prevention. Rehabilitation. Early and multidisciplinary rehabilitation was crucial for functional recovery, aligning with evidence that intensive therapy improves long term outcomes. In this particular case, the learning points are public education. Awareness of stroke symptoms and the importance of immediate action can reduce delays in treatment. Time sensitive interventions, the time and brain concept underscores the need of rapid diagnosis and treatment to minimize neuronal loss. Comprehensive care stroke management extends beyond acute treatment, requiring long term risk factor control and rehabilitation to optimize recovery. In this case, the patient prognosis, the outcome of MCA occlusion stroke can vary greatly depending on the severity of the damage, the speed of treatment, the individual's overall health. In this case, the Kumar was treated by thrombolytic therapy. How does it works means thrombolytic medication mimic the body's natural fibrinolytic system, activating plasmin, which break down the clot, improved blood flow. By dissolving clots, these medications restore blood flow to affected areas, preventing further damage and improving outcomes. For the emergency treatment, thrombolytics are often used for emergency treatment conditions. The altipase works by binding to fibrin, the protein that forms the structure of blood clots, and enhancing to conversion of plasminogen to plasmin. This process leads to the breakdown of the clot and the restoration of blood flow. The patient is furtherly shifted to the neuro ICU. They will take care of the patient and continuously monitoring for any adverse effects of the drugs like bleeding, any injury and all. Coming into the conclusion, the left AMC occlusion will be